It is 6:13 on your Saturday. Let's turn now to the COVID crisis. The CDC now says COVID-19 is the third leading cause of death in the United States. This comes as Georgia reported more than 2,800 new cases in the state on Friday. Now, this number is slowly trending downward. However, we still rank among the highest rates of infection per capita in the country. So we still have a lot of work to do to contain the outbreak and save lives. The death rate is still alarming. In Georgia, the Department of Health reported nearly 100 new COVID-related deaths on Friday alone. Most of the deaths were among those with pre-existing conditions or older patients. Now, in the midst of working to contain the outbreak and save lives, financial struggles combined with impacts from COVID-19 are forcing two rural hospitals in Georgia to shut down. This week, Northridge Medical Center in Commerce announced it will be shutting its doors. Just 3 weeks ago, Southwest Georgia Regional Medical Center in Cuthbert announced the same move. Both hospitals will close in October, putting more than 100 employees out of a job. We spoke to the president of a statewide initiative to increase access to services for communities of color. She says these closures will have a devastating impact on Georgia's poorest families.
There are at least a dozen hospitals in rural Georgia that are going to close. And I think being in the middle of a global pandemic uh, highlights and puts a fine point on the need for universal access to quality health care.
Northridge Medical will be the 9th rural hospital to close in Georgia in the last decade, only 28 remaining.